to Pacer Nursing Power Hour, your go to spot for real talk and real tips in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour, where students get powered up.
Love it.
Still gets worse every single time I do it. Okay.
Love it.
Okay. We say this every single
Every time.
week.
Every time. We are not excited. We are
Thrilled.
thrilled.
We're using different adjectives. Because
Thrilled.
we say excited
Every
every single time.
Week because we are starting a new series this semester.
Yes.
And
Super cool.
we are titling it A Day in the Life. And we are introducing different areas of nursing.
Yes.
And our first guest is here, Amber Miller, who is faculty here at USC Aiken, but she is also a nurse practitioner. So this week is all about everything nurse practitioner.
Also, she's a USC Aiken School of Nursing graduate, as are you. Amber, you were in my first clinical group,
I
right?
think I was in your
No
first.
way.
Katie followed.
Oh, how fun.
Yeah. Crazy.
Love it.
Love it. So we
It.
brought her over to the dark side with us out of practice, although you are still practicing.
Okay.
But we have tons of graduate students, and I know I go off script, sorry. We have tons of students when they graduate, they say, I want to do this, I want to do that. So, people, we're bringing it to you.
Yes. And when I went through this program, I think we've talked about this before, but when I went through this program, I had no clue what options there were after I finished my BSN. It just wasn't a common topic.
Well, hello. When I graduated nursing school, there
weren't other options.
the conversation was, I can't wait to work in the ER
Yeah.
or go to ICU because
Yeah.
you had to do med surge.
Right.
Yep.
Well, that's something I try really hard to integrate into my class, even though it truly has nothing to do with it. But I do open that door for students if they have questions and allow them to ask those so that they can kind of plan ahead, because there are some reasons why you would want to know if you want to go an NP route or a CRNA route or anything, which I'm sure we're going to touch on.
All right. So our guest, we said Amber, Professor Miller. So tell us, when did you graduate from with your bachelor degree?
I graduated from USC Aiken with my bachelor's in May of 2014.
Okay.
Nice.
So now,
So what did you do after that?
So I worked in the emergency room
Where?
for about a year at Prisma Health Baptist.
Okay.
Well, back then, Palmetto Health. It's been so long.
Yeah.
But worked for a year in the ER, and then from there I went to work in a labor and delivery unit. Did high risk obs.
Oh my God! How did I end up with two of you?
Women's health. I did. I did that for about 3.5 years. And then I was in my graduate program during that time when I was.
What made you decide to say, "Hey, I want to go back to school"?
I saw the side of nursing where you could really dive into, I guess, getting to know the families a little bit more and the outpatient side of things.
Mhm.
And I started to think, what would that look like? Like, what would a future in outpatient nursing look like? Because at that point, I had only really done inpatient nursing.
Okay, good. That's a
And
good observation, to be quite honest, because you were still a relatively baby nurse.
I was, yeah.
Yeah.
I was. And so I was considering what that would look like. And I really just thought the nurse practitioner role felt like a better fit for me and what I wanted to do than and so I kind of was like, hey, what would this look like? I talked to some people and I really just took off from there. I was like, I think this is it. And
Okay, so for the record, both of you two are APRNs, Advanced Practice Registered Nurses. What's your specialty in?
I'm family.
And yours?
I'm also family.
So how did you decide that you wanted to do family?
So
Now, do you have an idea of what you wanna do when you go in? I'm asking both of you. When you go into, because there was a hiccup of a time where I thought I wanted to do peds and P.
yeah.
No. But then I'm like, "No, I know I figured out what I do." But what was the pull other than no wanting the other side, the
Mhm.
outpatient side? What was the pull for you to choose your specialty?
Well, I think you have to have somewhat of an idea, which is why I like talking about it in class because depending on what program you go to, they're only going to offer certain tracks.
Okay.
So if you wanted to do acute care, then you need to have a program that offers that versus a program that offers family. So you do follow a track, um, and not every program offers psych or peds or whatever. So
Yeah.
you kind of sort of have to know because when you're applying, then you need to know what track you're going to be going on.
Okay.
Yeah.
That's very different for me to even think about. I mean, I have a better idea of it being in doctorate, um, but, like, when you talk about family nurse and then you talk about acute care, in my mind, I guess it's just, again, my mind, and it's not normal. If acute care is, like, in the hospital, right?
hmm
So if I did acute care, but I wanted to work in the ER, I would kinda think I would need to do family.
So in the ER, you can be an FNP. So
Okay.
I could work in the ER right now. Yeah.
Okay. Okay.
And
Well,
then
you do, you work at urgent care.
yes, I do. So that the other thing that I didn't know before going into and it just worked out, but I try to tell students that are in their BSN program to kind of loosely plan ahead is that some programs require that you have 2 years of critical care. I don't
Hmm.
know where you
I went through USC.
Okay, I did as well. So we went through the same program.
Okay. Oh, that's another
Yeah,
similarity.
yeah. So,
Crazy.
USC Columbia requires that you have 2 years of critical care experience prior to applying, and it has to be within the last certain however many years, I
Yeah.
can't remember
I
exactly.
mean, that only makes sense.
Yeah,
Mhm.
but there's a lot of programs that don't require that. So if you're fine going to one of those programs, so be it.
Ugh.
Start your career wherever you want to, but if you're interested in going to somewhere like Carolina, then you kinda need to plan ahead
Mm.
and say, "Okay, well, by this time, I wanna start my FNP. I'm gonna need 2 years prior to that in the ER, ICU, or whatever."
So what made you wanna go into family, Amber?
Like I said, I had worked ER and then women's health, labor and delivery, and things like that up until that point. I still had an interest in pediatrics from my clinical experience through USC Aiken as a student. And so I had that door still a little bit open of something that I may want to pursue, but I wasn't confident yet whether I wanted to really commit to pediatrics or if I wanted to keep the door open on like women's health and things like that as well. And so really I pursued family health just because it allowed me a broader range
That's a
of
great
where I could
point,
go from
though.
there.
That's a great point because we've all seen that pediatric component in this area is that market is saturated.
Yeah, I think FNP is a great route for someone who's not 100% sure or likes multiple specialties.
Mhm.
As an FNP, you can always specialize or certify, I should say, certify in a certain area. So if I wanted to certify in women's health, I could get a certification in women's health NP. So
I'm learning all kind of things.
yeah, so it's a little bit different than your BSN, like just a
Mhm.
typical RN
Yeah.
licensure.
So we know you work in urgent care. Where are you practicing?
I work as a nurse practitioner in a pediatric clinic, Southern Med Pediatrics, and I work at the Batesburg location.
So you ended up, even though you have your family nurse, you ended up in a pediatric
Eh,
world for practice.
Now I have a question for you
Sure.
because I feel like for myself and for all of my friends who went through the FNP program, those peds hours are the hardest hours
They're-
to fulfill
Yes, they
for
are.
your requirements for graduation. So how did you get those?
All right, wait a minute. Wait. Back up though, because you all are saying things that I have no idea what you're even
Okay.
talking about.
So throughout our program, you have a certain number of hours that you have to fill for like, clinical hours,
Mhm.
and you have to have a certain number of women's health, a certain number of pediatric patients,
'Cause
and
it's
then
like
just
a
general
so
adults.
family health is like the generic
Yeah. It's a very broad
BSN
umbrella.
where we give you peds, we give you
Yes.
psych,
Mhm.
we
You
give
get
you
Mhm.
you
a little
get
bit of all
a
of it.
little bit of everything.
Yes. Yes.
Okay.
Yes.
So you have to have clinical hours in each
Mhm.
specialty.
Yes.
How many?
I wanna say it was, like, 124
That sounds about right.
general, like, adult hours, and then, maybe, like, 70 something women and 70 something peds.
Okay.
So, like, 280 total maybe?
So per semester.
Nope, total for your program. So it was over a course of what, 2 or 3 semesters where you did your clinical hours with course load.
Okay. And did you have to find your own preceptors?
Yes,
And
that is very
that was
different
the
from, like,
trick.
med school where they match you with
Right.
someone, and I think I don't know this, so don't somebody needs to fact check me, but I think PA programs typically match you. That is something we I know at our
Yeah,
program we
no.
did not, and it's kind of a hot topic.
It really
It
is.
is.
So not only so we've talked about this. We last week we talked a lot about health deserts in the country.
Mhm.
Um, but that's a really good conversation to have because it is not only you got to make sure your school that you're at has a contract with
Right.
wherever you're going,
Right.
but you got to say, hey, and I know so many nurse practitioners, they're burned out on
Mhm.
having students.
Mhm.
Yes.
One of my nursing loves is an MP up in Columbia, and I would have so many people go, "Hey, do you know anybody?" I'm like, "I do. Let me text her." And she's like, "I'm
I
burned
can't.
out. I can't do it anymore."
Mhm.
You could take students constantly, and I mean,
Right.
there's such a need.
I mean, students are desperate to get
Mhm.
It's
hours.
so hard. It's so sad. Okay. All right. So you work in a pediatrics. You're in that. So how long? How long has it been for you now that you've been that in that world?
I have been working, and I've been at the same office in pediatrics since I graduated from grad school. I've been at the same place, and I've been there for 7.5 years.
Oh, wow.
Wow. Again, long termer.
That's
Hmm.
awesome.
Yeah. That's
That
crazy.
is really
I
awesome.
mean, that's
So
not
did
crazy.
you
It's good.
so did you get your peds hours with this office?
I did. I
Okay,
did.
cool. That's where I was going with that. So
I
yeah.
did. I did.
That's amazing.
So I'm
I love
honestly I
that.
mean, that's really cool that they took you as a family nurse practitioner because I know
That's
peds
right.
offices are very selective and typically only take peds and Ps.
They are.
Yeah, but you slid in
Slid in. I
right
had a connection.
I was about to say,
before.
did you know
I did.
somebody?
My
Cool.
sister-in-law's a peds
Oh,
nurse
cool.
practitioner at this
Cool.
office, so she helped me get in.
Yeah, okay, that's incredible. So, you wanted to go into family nurse partitioning for the outpatient perspective. Tell me how you feel about that now.
I love the families that I've gotten to take care of. I have some families that, like, I have seen the kids since they were a newborn, and now
Oh,
they're
that's so
7, and it's
cool.
so fun to just follow them along and just keep up with them. Like, what are you doing now? What are your interests? They'll, tell me like, oh, now I'm, playing this sport. And it's just fun to keep up with them and see them. And now a lot of them have younger siblings. They're
That's
the
so
big sister or whatever,
fun.
maybe. So
So,
that's really my favorite
all of
part.
those developmental things that we did in
Yes.
clinicals you're using. I
Yes.
love it. Okay, so
So
but
fun.
here's an aside question because I do this to Keegan's all the time. I texted
Yes,
her last
she
night. She
does.
goes, "Nope." And even people do it to me. How many people FaceTime you with their kid on the phone?
Oh, all the time. All the time. I feel like I get messages and texts and video, all the things. So it happens a good bit.
I texted her last night. I'm like, I need some IM Toradol. I'm like,
I was
what happened to the good old days when you carried the bag and you
Yup,
had some drugs in the
yup.
bag? I
I
just
don't
needed
have that
some
one.
Toradol. It's just IV ibuprofen.
Yep, yep.
Okay. All right. So everything that you thought you were dreaming about,
Mhm.
do you feel like it's a reality right now?
I I I do feel like I've been very fortunate in how things have played out, and I do feel like this role as a nurse practitioner, while I have learned so far beyond what I thought this role would be, um, uh, but man, I've learned so much, and it really has been a gift, like, getting to care for those families and walk through different seasons, and some have been, like, so celebratory and so exciting, and then some have been, like, truly heartbreaking, but
Ugh.
again, it all
Yeah,
it
that's
all
right.
grows you, and,
True.
I mean, I'm thankful for all of it because now I'm a far different nurse, provide anything than I would have been when I started.
Isn't
So
that
it
great?
changes you, it does, but,
I think and I tell this to students, and y'all don't remember, obviously, because I think I try to tell every single one of them. It's not what, like, what you do, it's what you learn
mhm,
along that journey and you keep with you.
that's right.
And I love that. I love that.
So, the majority of our viewers are students, new grads, and then we come to find out parents kinda like us too. So,
Yeah.
I definitely want
Thank
to
you for our follower mom who religiously follows us
Yes.
that told me this last weekend. I got so excited.
That
You're
is
you're
exciting.
nuts.
Her daughter's not even in school yet.
I love it. I love it. So I want to definitely drill home the journey. We talked about what your path from like RN to NP looks like.
Mhm.
You have a vast wealth of knowledge in different areas, which is way cool. And you told us that you worked as an RN, which a lot of programs do not require. You can go straight out of your
I
BSN
That's kind
know.
of
program.
a growing thing, I feel like.
Yes, yes,
Well,
straight
I mean,
into an
that's what our
FNP.
students are doing. That's what they're doing right now.
Yeah, so I do like to tell students to, like I said, plan ahead a little bit, see what the requirements are so that you're prepared whenever you want to go back to your FNP.
Mhm.
How did you decide what time was right for you?
Yeah, like, when did the kids come in?
I feel
I
like
get dirty. I'm sorry, I'm nosy.
I like when this thought came on and I was like, okay, what would this look like? Like, I just got excited and I was like, if we're going to do it, we're
Let's
going
do
to do it.
it.
And so I just kind of dove right in. And things just
How old were
thankfully
your
worked out
kids?
beautifully. I had no kids when I started. When I finished my nurse practitioner program, I was hugely pregnant. I took boards, A and P boards, like 36 weeks pregnant, and just praying that like my water didn't break and that we would make it through this test.
With
Yep.
baby number 1?
Baby number 1.
Dang,
I
girl.
love
I
it.
Did
did.
you have to get up and pee at all during that? Because I mean, I pee every 20 seconds anyway, as it
Now,
is.
now certification, our boards are a little bit different. It's
Mhm.
not like never ending, goes on and
Mhm.
on and on. It was 75 questions, right?
I believe so.
Yeah, it was a set number.
It was like a final.
Yeah, kind
Yeah.
of, honestly.
Wow.
It
It
was
was a little
different.
bit
Yeah.
different. It was different. I was kinda mentally prepared during the whole program for, like, NCLEX style,
Mhm.
and then it was
Application?
not what I ex
Or no
no, I mean,
knowledge?
no, it was a lot of application and analysis and whatnot, but it just wasn't this, "Okay, am I doing well enough? Am I doing" you're gonna know
Yes.
didn't you find out on the
Yes.
computer?
Yeah,
Yeah, you
y'all
know right
yeah,
then
Yeah.
y'all
whether you
said
passed or failed.
you get a
Mhm.
right away.
Mhm. Immediately.
That's just insane to me because nurses, we like to torture a little bit. I mean, y'all know I'm right, right?
Yeah.
But I just saw an email announcement of, new next gen stuff coming out.
Yep, I did see that, I did see that.
That's crazy. Okay, so
Now, I were still working in the ER when you applied
yeah,
to
that's what
FNP school, or had you
I
already transitioned to L&D?
It was between that transition, somewhere around there.
so
Okay.
not only were
I think I
you
was looking and thinking, and then I think I got accepted and started when I was in the L&D.
so
Okay,
not only did you transition from an entirely 180, 1,000%, unit,
I did.
you started graduate school.
I did. And now I think back and I'm like, that was insane. What
Yeah.
did I do? But
Mhm.
yeah, at the
I get
time I
asked
was
that a
just like,
lot.
this is what I'm going to do. It's a great idea for all of these reasons. And I just did it.
just
Like,
did it.
I think, and maybe that part of that's just being younger because now I
Mhm,
feel like I would hyper analyze all of that. And like
mhm.
now, like you said, saying that sounds wild, but I did. I just kind of jumped in.
I love it.
One of my the nursing love that's a nurse practitioner, we graduated.
Hmm.
She got in school. She worked back then. We had what's called weekend option, and you just worked Saturday and Sunday and got paid for the full week.
Mhm.
She did that on the weekends and went to school during the week.
Yeah.
Yeah, it's insane.
How would you explain the differences or similarities of your BSN program to your FNP program for students that don't know?
Yeah, gosh, I think there are some similarities. Like my FNP program, I feel like I found like, friend or 2, it was
Mhm.
all online.
Yes,
So
so
it's
that
funny how you find your people, but you still do. Just like
You
I did in
do.
undergrad, I found that I, like, kinda found my people. It was, like, 3 of us, and we would
Same.
chat, and then me and one girl got really, really close, and it was like the 2 of us against the world. Like, we could do anything, I
Yes.
feel like,
so
and
do you still talk to
uh
her?
I do sometimes, yeah, yeah. And
Awesome.
so that's wild, but and I was worried that with it being all online, I would feel so disconnected, but you kinda get to know them
You
just like
do.
you get to know your classmates in a different way, but you do, and then you kinda develop your little
I
your
mean,
group and
you have to respond to 2 peers.
so many discussion
I
boards.
need to know who my peer is.
Yeah, no,
Exactly.
so mine is Pinnell and Union. She keeps me
I
straight.
love it.
Yeah, yeah.
That's so
So
funny.
what was alright, so but compared to nursing school, how
Mhm.
was juggling working and you were married at the time.
I was,
How is
married but no kids, so I feel like that's a big part of it. Like, now, again, I think, gosh,
like,
if
what if you went back and
kids in
got
that
your
time, yeah, I
doctorate?
think it would be, even more pieces that you're juggling, of course. So, I'm thankful that I started a little earlier just to allow a little bit more cushion there,
Mhm.
because it is still quite a bit to juggle. Um, but yeah, I worked, full time for a little while, and then I went part time, and then was kind of juggling working on the floor and then doing this. But um, as I got, like, maybe to the last little portion of my program, there were some other girls on the floor who were going, like, starting the program.
Mm.
So again, we would kind of bond over the juggling act that we were all doing too. Like,
Mhm.
hey, how are you handling this? Or what's the
Mhm.
best way to do this? Kind of. And so we would talk a little bit up there too. And even though at different programs, like
You
at different
figure
universities, it's
you
still,
figure out a
yeah,
way. You get your people, and we
we
talk
do.
about a village.
We
We
Mhm.
talk
it
about the village all the time. So what was the most challenging part of it for you?
of the program, well, gosh, the immediate thing that I think of is just finding sites because it was such
Yeah.
a tricky thing, and they had to have contracts, and if they didn't, you had to form one, and it took so long to form a contract, and I remember just going around, and trying to just meet people at offices and, "Hey, can I have a second of your time? I brought donuts,
Yeah. I love it.
someone
You
please."
No,
you took
seriously.
food?
Oh, yeah, I tried to bribe with donuts multiple times to get clinical, preceptors. But yeah, you just find a way.
You
So,
do.
I'm teaching that nursing elective, the social
Yeah,
media,
okay.
and one of the topics is it's really great for networking.
Yes,
Social media is
absolutely.
phenomenal
Mhm.
for networking. Um, and did you go on a platform and say, "I'm looking for this"?
No, but and I guess maybe I wanna say maybe it wasn't as popular then, but maybe it wasn't, I just wasn't aware. But that is such a good point because I feel like networking, it opens so many doors for you,
Mhm.
and I feel like the earlier you learn that and learn the skills that go along with that, the more
Mhm.
successful a lot of times that you are going to be.
It really is.
And so I kind of wish someone would have nudged me in that direction, even in, like, BSN level, like,
Oh, yeah.
early on because it's a game changer.
Well, I mean, it kinda all goes hand in hand, though, too, with mentoring
Mhm.
people, whether you can mentor someone and say, "Hey, I know how to get you somewhere to talk to someone,"
Yeah.
and then you just start that thread of conversation. How did you find your preceptors?
Well, I'm a little spoiled, so
Oh, yeah.
my you're just like, "Oh, yeah, I know." So, I am spoiled a little bit when it came to my FNP program. My uncle was a physician in the area for years. I mean, he's worked in the area for years and years and years, so he knew everyone in the area. I connected with him first, which he actually got denied as my preceptor. I was not allowed to have him
'Cause he's
as
your
my because
relative.
he's my
Uh-huh.
uncle. So then he was like, "Hey, can you precept my niece to someone else in urgent care?" So that's where I did my first rotation. And then a friend that I was in school with did
Mhm.
another rotation in family practice here. So then she and I just kind of
Uh-huh.
flip-flopped.
Yeah.
I hooked her up with that urgent care site and she hooked me up with family practice. And then my uncle um knew of another nurse practitioner out in Wagner. So then I did my last rotation
Oof, I'm
there.
so sorry.
Yes.
Okay, so this is where I think, Lorsh, I had it in my brain and it was about to come out, but I forgot it. Keep going, sorry.
No, that was the end of my story. Sorry. That's all she wrote. And now, circling back to
Oh, I know
peds
what it
and
is.
women's health hours, in urgent care, I was able to get all of my
Oh, nice.
peds hours, and then I was with Dr. Minto at Aiken OBGYN and did a women's health rotation specifically with her and learned so much.
Yeah, yeah. She's so
So
good.
smart.
Okay, so this is kind of, and I know that we have a question left, but this is really what I want some of our viewers, everyone to understand.
Okay.
So you graduate with your FMP, you pass your boards.
Yes.
Okay, so talk to me about, because you mentioned, Katie, that y'all have to renew, not just renew, but what? I thought
What do
you don't have to
Well,
retake
there's a
it.
lot of things. Yeah, you don't have to necessarily retake a test. You have to have a certain number of like continuing education hours. A certain number of those have to be in prescriptive authority. You also have to, if you prescribed controlled substances, you have to keep up a license with the DEA. So there's a lot of things, and whether they're annually, every 3 years, every 5 years, it's always, I never know. I just wait for the letter to show up or the email to show up, and I'm like, okay, yep, there's those dollars.
Okay, so then that's one whole aspect, and then prescriptive authority is another one. Or do nurse practitioners have full prescriptive authority right now in the state of South Carolina? Now I know that goes into, what the next question is that I'm going to talk about. Ask.
Yeah.
All right, should we talk about that first?
It doesn't matter.
All
Yeah,
right, go ahead.
maybe overseeing providers would be
Okay,
better.
so I recently learned last year on Legislative Day, which is why we're going back this year, because it was such a cool day. It's in 2 weeks on February 26th. And part of legislation that was on the table was autonomy, full autonomy for nurses. I learned that
Nurse
practitioners, sorry. I learned that day. I am almost 1 year old of learning this. That some nurse practitioners, depending on where you are, you have to pay a fee to your overseeing provider per month, and that cost can go up to, what was it, 1,000 a month, or I don't know. It was like they literally, and they can only have how many nurse practitioners under them? What, six?
6.
Is that the law?
6.
So basically, they can make $6,000 per month, 72 grand, and look at 2 charts for y'all over the course of a year.
Yeah.
Do you have to pay a provider?
I do not.
So her setting, you're working alongside providers,
Mhm.
and I'm guessing your documentation has one of them signed off on you, I'm guessing?
Yes.
So
And
it's
you work alongside a provider.
so I was a little different when I worked out at Wagner. It was a completely NP run office. There were no physicians in the office. So we paid our overseeing provider $1,000 a month in order to be our overseeing provider.
And what does the provider do for you? Does he have to sign off, or she sign off on every chart of yours?
I wouldn't say every chart, and I don't know all of the details of his side. But I do know that he generally kind of does audits kind of on some of mine.
That's a good term, generally.
Okay. So there's the cost of having that. So now then, prescriptive authority. You have your regular non-controlled substance. What do you have to do to keep that up all the time?
That's $125 a year, I think. Is
Uh,
that right?
So how much is your license? Is every 2 years?
Our licensure is longer.
How often do you have
What
to
is that,
renew?
every
Because we have to
5?
renew every 2.
We'll renew like through LLR
Yeah.
still every year like we would as a nurse, but then we also have like our certifications that we have to do, and mine's 5.
I think it's 5, yeah.
Okay, so
Which
now
is coming up,
so
right?
you have to
Yes, it is.
Yeah.
so you have to pay for your RN renewal,
Yes.
and then you
Well,
have to.
it's like your APRN.
Yeah.
So you only do
That's rolled
APRN,
in. Yes.
but you only do that every 5 years.
I think that's every 2,
It's
and I
really
think my certification's every 5.
Okay, every 2. Okay, that's like nurses, every
So
2.
it's a little bit different. We have licensure, certification, normal prescriptive authority, and controlled
DEA if you have-
substance.
That is
DEA
way too
prescriptive
much.
authority. Yeah, so you're paying for all of those individually, which it does add up. It is
That is a
expensive.
lot of money. So I would imagine your DEA number, is it DEA?
Mhm.
I don't know why I was thinking DEI. The DEA number, is it hugely expensive?
I couldn't tell you. I just pay it when I couldn't tell you.
I can
I
imagine.
know there's
I want
one.
to say it's like 800
Yeah, that's what I was gonna guess. I was
Holy
gonna say
bacoly!
812. 812,
Yeah.
yeah.
How many how often?
Is that what every I don't know.
Y'all are
I
killing
literally
Because
me.
I
do.
work at an office, and so they really initiate, like
So
I mean,
you
I'll get, like you said, email reminders, and so I have a lot of the deadlines or renewals set on my phone, but I'm not always thinking
Yeah, I
about
don't
it.
keep
I
up with
just
it.
kind
It's
of
just when
so
they
I
show
just
up.
so
know, like,
much.
every
Yeah,
even year, I've gotta renew my RN license right now. This
Yeah, that's
April's the month.
right.
$75.
Mhm,
I know that
Yeah,
one.
and BLS is every 2
Yeah,
years.
yeah,
mhm.
no, ours are so it's not every 3 years for everything. There's no consistency among all 4 things, so
Right.
I lose track of
Mhm.
when what
That's
is.
insanity.
Yeah.
So there's something that I know you did that's very unique because you were an independent, not a sole provider in the building.
Mhm.
You had to learn how to bill.
Yeah, yeah, so when I worked out in Wagner, that was a skill that I am grateful I learned. It is a lot, but I feel like it will be a skill that I take throughout my whole practice.
I've heard you talk about it even here.
Mhm.
I mean, it's
Mhm.
so you don't do anything with that?
I do not now. When I started and we were a little bit of a smaller practice than our group is now, we did bill our own uh back then, but we don't anymore. We have a whole billing team now.
It's a beautiful thing.
So
Yeah.
did you have to learn like DRG numbers and all that kind of good stuff?
CPT codes.
Yeah,
The
CPT
CPT codes,
codes.
yeah?
Yeah.
Wow.
And then just
So is that part of the curriculum?
No, not in F&P school. You get a brief little overview of like what your higher acuity patients like a 99215 versus a 99211, and what the difference is between a new patient and an established patient. You get a brief
Y'all are gonna make me be a
overview.
1050B right now.
You get a brief overview, but definitely I was totally blindsided when I went
mm,
into the field and when I worked in this little clinic and we didn't have a billing team, couldn't afford a billing
So
team.
did you have any like business courses part of the curriculum?
no.
No,
Nada.
none.
And
Nada. Any interpersonal
What do you mean?
bedside manner?
Well, no, because like in our program, you had to have had 2 years.
mhm.
So that would be a waste of people's time.
No, I'm talking about communicating with families.
No, but still, like we're all already BSN. We've all had experience going into this Carolina program. So,
To be fair, I think y'all it would be better. Y'all are better. This is what I'm okay. So y'all are speaking to someone who only uses mid level. If there's not an MP there, I mean, she knows who my primary care doctor is at Minute Clinic.
yeah.
Rebecca, love her. Um, but I'll use a mid-level practitioner. So, but because I feel like y'all already know what patients and families are going to want to hear, so you know how to talk to them about it.
Mhm.
Whereas this physician who took care of my uncle who
Didn't.
did not.
Right. Right.
So, okay, so we've talked about your curriculum. You get no business stuff, but yet you have to figure out how to do this, right? That's insanity to me.
And I would recommend to anyone who is entering their first job, like when they're interviewing for that first job, I would ask questions like, "Hey, what licensure or prescriptive authority things are you going to pay for?"
Yeah, that
Because
was
you
about
can
to say.
negotiate those things.
Yeah.
I would also ask what your mentorship period will look like.
Is that like a preceptorship?
Well, I mean, just what they expect of you out of the gate.
Mhm.
I know I had certain job offers where it was black and white, where they said the first 6 months you're going to see 10 patients a day. After the first 6 months, you're going to go up to 15. After a year, you're going to go up to 25, kind of thing,
Wait, what?
where you're required to see a certain number of patients a day. Other areas,
Okay, wait. So it's not based on what you're seeing. It's based on how many you can get in and out,
yes, yes,
which is why you only see them for 3 minutes at a
yeah,
time. But you were waiting for 30
yes,
outside in the waiting room and then back in the room.
yeah. But there are, but when I say like mentorship, I, as a new FNP, would ask questions of how many patients do I have to see a day? What is required of me, like billing and whatnot,
Yeah.
Mhm.
but also someone that can show you the ropes. We in my practice, we hired someone to do all of our credentialing for us, but even though I had someone that was, quote, unquote, "doing it for me," it made no sense to me. I was constantly getting asked, like, "Hey, send in this document," and I'm like, "What is that document?" You know? And applying for your DEA, things like that didn't happen
Good
right after
Lord.
school.
Mhm.
Malpractice insurance, those kinds of things that first
How
year.
expensive is malpractice for you guys?
My first year, it was over $3,000.
A year?
Mhm.
What about you, Amber?
I've had it all through my
All
company
through,
working.
yeah. And again, negotiate.
So there's a lot of red tape that you guys have to do after
Oh,
graduation.
for sure.
And we talk about the nightmare of getting ready for them graduating and NCLEX and like especially if you live in a different state and you're gonna work in a different state, like the nightmare of that. This is a whole. So can you? That brings me to another point. Can you guys cross states? Is it a multi-compact state licensure? I don't think it is.
I've never tried.
Ha ha. Okay. Okay, I really am gonna
No,
go across the street and check myself
I've
in.
done a quick Google search because I would love to work remotely right now. And most remote jobs want you to work in at least or have licensure in at least 5 states. And from my understanding, per Google, however reliable that is, it's just a fee. You pay a fee per state.
So that's interesting.
Yeah. So a little
Okay.
bit different, a little bit different.
Okay, so what advice would you Amber, would you give to someone who's considering it?
Oh goodness. Like I guess like she said, just consider all components of it. Like I guess forefront, thinking what's going to lead their critical care experience and things like that. But then too, like, do you want to what pace do you want to work in? Do you want to do more of the acute care setting or do you want to do family? And then do you want to limit to a specialty? Because, like, I work with some nurse practitioners who have their PNP and they only do that. Um, Whereas, like I said, we've had some people come and then they'll transition to a family practice office from the pediatric setting, and you have that flexibility. So just thinking, what doors do you want open long term, and what settings do you want, and the schedules that accompany those settings. Like if you're going to do more acute care, you're going to be more hospital based, and you're going to have a schedule that looks more like those hospital hours versus outpatient family practice.
Now, are
Tradition.
you ever on call?
Yes. I don't take call anymore really with the transition to this role.
Mhm.
But yes, I was on call previously. And so on our call weeks, um, I would have call through the duration of a full week. And thankfully, we had a nurse practitioner who would round on newborns Monday through Friday. But like on our Saturdays, we would be responsible for taking calls that came through. Um, from our triage service. But yeah, so we would have to take the calls. We would take hospital calls as well because we would round on newborns at 3 different hospitals on Saturday and Sunday.
Holy cow, I
So
just wanna stab myself in an eye right
well, that's not
now.
even all of it. I would round on the 3 hospitals and have to be in clinic to work clinic from 9 to 12. So I would have to hit all 3 hospitals and see all the
Did you get
babies.
extra pay or were you salaried?
It was embedded in salary. Yeah! Which is a good question up front.
Yes, that is another great question.
So you just said something that kinda ties directly into this transition. So you work for a pediatric office, right?
Mhm.
You're a family nurse practitioner
Correct.
office. So and you talked about the peds nurse practitioners, is there a chance where you do something other than pediatrics, though, in your day-to-day work? They're all peds patients,
No,
correct?
right, because we only saw patients up to age 21, and after 21, then our peds
Okay,
is,
so
like,
for
our
y'all,
scope.
21
Mhm,
stops.
21.
That's interesting. Huh. So, okay, we last week we talked a lot about, barriers to care. We
Mhm,
talked about deserts and stuff.
mhm.
Do you see you do work in a rural area? Um, do you see a lot of barriers that people have to overcome to get to your office to see you? Do
So
you s
sometimes it's the situation of like the car and we're sharing a car, something like that. We will have that. Sometimes we have actually a great deal of patients who are Spanish speaking families,
I
and
was about to
so
ask you that.
we see that a good bit too.
Do you
But
have a
our
Spanish
office
provider?
is wonderful. We don't have a Spanish speaking provider, but we do have a front desk staff who is fluent in Spanish as well as an MA in the office. And so both of those are in office help that are phenomenal.
Beautiful.
So that makes things far more seamless than they would be otherwise because I've been in other offices at times kind of floating in things. And if you don't have those, you're using a language line or things
We've
like
all
that.
used that blue phone with the
And
2
it's just,
headsets.
it's different. It's,
So how much time okay, so how many you said you have to see you work in an urgent care.
Yeah, my life is different.
Yes, but don't you have a quota to meet per se?
Yes, so 4 an hour is what we're supposed to see.
Okay. But when you were in a clinic setting,
Yeah, when I was in family practice, I had 24 patients a day.
and how many what were those hours? 8 to 5
Yeah, probably 8 to 5, yeah.
with any lunch?
Yes, I did have a lunch. I can't remember if it was I think it must have been 30 minutes.
Okay. So
Yeah.
8.5 hours.
Yeah.
And you had to see 25?
24 were scheduled, and then if anybody walked in, I would see them.
Fantastic. How many patients do you have to see in a day?
so our standard schedule, like the shell of it, holds 36 patients a day for an 8-hour span. We work 8 to 5 and have a 1 hour lunch.
36.
36 with the possibility of, like you said, a
Walk-ins.
few if something is a certain level of acuity that comes in and we would need to see it that it couldn't wait until tomorrow, we work those in too.
I forgot to ask, what's the biggest acute illness that you're seeing right now? I can only guess.
The most common,
Mhm.
like viral upper respiratory
Mhm.
illnesses of
Yeah.
sorts like
All right.
flu and RSV and just different things
Ugh.
like that.
Okay. All right, so how much time do you think you spend charting?
Oh, gracious. It depends on what all's going on with the patients that you see. If it's like if I have a kid who comes in and, it's very straightforward. I've had drainage, runny nose, and now my
You
ear hurts and it's an
mm,
ear
Yeah.
infection and it's
you
all very straightforward. That charting is much more simplistic and I can put in some like saved things that I have
Yep.
that I use
What are
a
they
lot.
called? The macros or whatever?
Yes, and
Yeah.
so I will use those and that I can get done quite
Wait, do y'all have, like, a copy
quickly.
paste kinda thing situation going on?
Yeah, you put in your, like, dot whatever.
Mhm.
Um, so I have, like, a dot URI,
Mhm.
dot whatever, like,
Yeah,
so
well,
it's already pre-saved, and you can kind of fill in the
and then
blanks.
you just have
Tailor it
to
to be
tailor it
patient
to yeah.
specific?
Mhm.
Okay,
So
cool.
that's
Yeah.
quite helpful. That's
Yeah, it
good
saves
to
a ton of
learn on
time.
the early
Do
end.
you find EMRs are more useful or prohibitive? That was a good word. You have to admit, I just used a good word.
Prohibitive,
Yeah.
yes, good for you. I
It's good
I
for
don't know
me.
anything else
Yeah.
really. I mean, back in
Yeah,
the
yeah, I don't know how to
day,
write.
like, it would be paper charts, but I mean, there's no other option right now,
Mhm.
so.
Alright,
And
do you perform any procedures?
from time to time, maybe some things, suture removal,
Suturing?
um, wart
I know you do.
suturing in the urgent care. Yes.
Mhm.
Um,
You don't get to pop any pus?
IUDs a little bit.
That would be my dream come true. That right there would be my sole motivating factor if I could just
INDs.
do all pus related
That's
wounds.
funny.
Funny. You're
But
funny.
you can imagine how it goes on a child too. So there's that.
Uh-huh, yeah.
Yeah, see, that's why I wouldn't do it.
Yeah, yeah.
Mm-mm.
I'd be in the ER.
Yeah.
I mean, I would probably be over there. Okay. So what is something you think that in your daily work that people would be surprised to know about or to learn about?
Gosh, just all that you can see in a day.
Oh, yeah.
That you can go from one room that is
What's the craziest thing you've seen without divulging too many details?
I
I mean,
guess
as kids,
yeah,
I don't know how they stay alive.
so many wild things. Well, the teenage population's a whole nother subset of that.
They are literally the epitome of here, hold my beer, minus hopefully not the beer, but
Yes.
still, it's that sentiment.
Yeah, they'll keep you on your toes. So there's that. Um, just like heartbreaking things. Maybe like neglect type situations.
Oh, yeah.
Just can't
Those
believe
are
it, yeah.
really, yeah. And then to go from a room and compose yourself and go see the next patient, I feel like that's one of the more challenging things.
Yeah.
And things like this that maybe, that next room doesn't even know that
Mhm.
you're walking from a situation to them
But they've been waiting a while, and
and they're
they're gonna
frustrated.
yeah,
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 yeah.
yeah. And you have
So,
to take it.
yeah.
All right. Katie, what's the worst thing?
I
Or weirdest?
um, I've had patients in family practice bring their tapeworm
Oh, fun.
in a
Awesome
bag.
that they
There's a
got out of
bag.
there behind
Mhm. Yes.
because they used the one and only tried
Yes.
method of diagnostic,
That's right.
the tape test.
Mhm. Yes.
That's good stuff.
Yes.
Vermox for everybody.
Yes. That was interesting. That was very interesting.
Okay,
It
so
is fun what you will be.
Yeah, you just have no clue.
is that what
No.
kind of keeps you going back?
Oh, I mean, yeah, it keeps you on your toes.
Aside from the money, but honestly, you guys should make a lot more money than what you do. I'm not lying. And I can't wait to get our CRNA in here
Oh,
I
that'll be
know.
fun.
That will be a
because
good one.
I mean, I know they're pushing gases, but come on now. It's like a triple what you guys could.
It is. But Amber, what is the most stressful part of your job?
I feel like really just giving each room the attention that they need and trying to get everyone seen within the 8 hours. And that's what I would say. Everybody would say, I mean, other people would certainly say different things, but, and then on the front end, as a new nurse practitioner, I feel like I would quadruple check my dosing because it's peds again. So it's not like
Mhm.
I'm in adults and it's Amox 875. Like
Yeah.
it's not a standard. And so
It's
in
weight
peds, I would do my dosing so many times and I would sometimes pull up guidelines and triple check, that
and do you
again.
know minimum? Do you have to know minimum concentration?
Yes, I mean, there's just so many.
Well, I mean, it's nurse practitioner. You don't have a pharmacist on staff, so yeah,
Right.
cool.
Um,
So that's the most challenging,
But I would
stressful
say,
part.
yeah. And so, yes, on the front end, trying to fit all of that in there. But even now, where some of that stuff I can pull far quicker, still just trying to give attention to certain rooms that need far more attention, maybe time wise, and trying to still kind of keep the pace of the day.
I would be fired. Y'all know how much I talk.
It would be a struggle.
I would be.
It would be a struggle.
I probably wouldn't make it through school.
It would be a struggle.
It's bad.
Yeah.
It's bad. So, what has been the biggest adjustment you had to make when going from being that BSN nurse to this APRN nurse?
So thankfully, I have worked in an office where my I guess you would overseeing provider has been so good to me and just a source of really great wisdom and has like wanted to kind of take me under his wing and be so helpful. So I feel like the hardest part earlier on was like just the weight of all the responsibilities on me. And like previously as a nurse, I could go say like, hey, something isn't right. I can't put my finger on what it is. And then I was all of a sudden the person like making the very specific diagnostic calls on that. And that was just a lot of weight and a lot of responsibility, especially earlier on. And even still it feels like I'll never feel like that's not a big deal, you know? But just all of a sudden being the person that everyone else comes to, and they're like, "Hey, what are you gonna do about this? How are you gonna handle this?"
You're,
And
wait a
so,
minute.
like I said, thankfully
Is that
my
me?
provider
You
was
talking to me?
Are you talking to me?
um was so good, and so
So you have imposter syndrome. You had imposter
yes,
syndrome.
absolutely.
And we
Um,
hear that with our new grads.
oh, yeah.
With any role, do you feel like that when you came to academia too?
Oh yes, yes,
Yeah,
yes.
I still feel
I
it.
think each big
Yeah.
transition, I have felt that.
And as you should.
But I think there's a healthy component there where you have
Hmm.
to understand like what is required for you in that role, and so that keeps you in line a bit. But
Do you find yourself slipping back into the RN? Like,
oh yeah, just I feel like I have to shift my mindset based on what I'm doing, and so
Mhm.
I have to kind of click into nurse mode. And
I remember when I worked in the ER, we had this PA. He just recently resigned. He was awesome. You remember Ben?
Mhm.
Um, but Ben would do so much. He wasn't a nurse, but still, he was one of those people that did and I would go, Ben, that's my job. Let me do you go do this because you can only do this.
Right, right,
And I would imagine it would be very hard for you to have to delegate certain things
right,
that you know how to do
right,
already,
right. And I see that in a lot of
because that's just
other nurse
inherent.
practitioners in the
Yeah.
office too.
Mhm.
Like some of the nurse practitioners I know who have worked as nurses for a while, like they'll still keep swabs in their pocket and they'll,
Mhm.
well, while I'm in here, let me go ahead and take care of this. But you're right. You do have to learn the balance of delegating though, because if not,
You will get
you
so far
are
behind.
not, yeah, you're
Yeah.
Do
not
you
going
get that in curriculum during school?
Time management? No.
How to delegate?
That's what clinical's for. You face
Wow.
with it, yeah.
Wow. Now I know I'm glad I'm perfect in the role that I'm doing. No, I'm not perfect in the role that I'm doing, but
You're
perfect.
amazing.
No, I didn't want to. Yeah. Okay, go ahead. Sorry.
Okay. So what is the most rewarding part of your job?
Oh gosh, just seeing patients like who come in and are just flustered and so confused about like going back to asthma, like all of the inhalers and like we're taking a maintenance as rescue
Mhm.
and we're not doing well and we're not
So
managing
you
well.
love that
No,
action
I
plan
don't.
that I made. You
I
did love
do.
that.
I do love that. No, I love like diving into that with them and being and explaining like how this works and I think that's why I always had this like draw to education too, but I like getting in there with them and like
Well, that's
cleaning
what
up the
you're
mess.
doing.
Yeah, that's really cool.
And so I think that's rewarding. And then they come back and they're like well controlled and life is great and you're
Oh,
like,
it's
"Yes, we did it."
amazing.
So that's really fun.
That is fun. That is fun.
I'm gonna brag on her for a second too, because she won't. She had a nagging feeling about a patient.
Yeah.
You're gonna make me cry.
She had a
That is
nagging
such a real
feeling,
thing.
and she went over and above what probably she should have not,
Yeah.
but it just wouldn't leave her. It just didn't make sense, and so she sent him. You're gonna make me cry if I see you cry.
I won't cry. I'll hold it together. I won't.
She's gonna
She sent this patient and had things further, and it ended up he had a very, very serious,
Mm.
and she just wouldn't give up. And I love that about y'all.
Yeah.
It's something, and I really do think it's inherent in nurses.
I do
It is.
too. I do too.
I think we bring something, or being a nurse
Mhm.
brings something additional.
Mhm.
Y'all learn, I think in MP school, is this a fair statement? So in MP school, you've got all your nursing behind you, right? So you're just learning the processes and how to be the provider,
Mm-hmm.
how to do those. Because are the assessments any different?
They're a little bit
A little bit more in
different.
depth
Yeah, a little.
in certain
Yeah.
areas.
Because
But
instead of just doing something, you really do have to understand when I do this, it means this.
Mhm.
This outcome of whatever means this. And you're testing specifically. I mean, you learn a full exam on a shoulder, not just documenting the patient has shoulder pain.
and range of
Right.
motion,
Yeah.
Right.
Yeah.
FROM.
Yeah. You know what this and this, all the things. So it's a little bit
So
different.
it's
There is a new skill
more
set.
in
Yes.
depth,
Like you
right?
get an entire
And
health
then
assessment course.
and then diagnostics, I would
Mhm.
imagine, is something a lot more detailed
Oh,
brought
yeah.
into it. But it's more of the what you do, not how you do it per
Right.
se, right? So I feel like in NP, you learn how to do the skills in more detail, but still, you're still a nurse.
Absolutely. And I
Absolutely.
think that is a defining difference between medicine and nursing.
Mhm.
I think it's ingrained in us from day one, from our dedication of hands. We look at patients holistically. And there have been patients where I look at their labs or I look at their vital signs, and yeah, everything can be normal, but you look at the patient and you know it's not normal.
Doesn't look right.
Yeah.
Your
So,
clinical picture doesn't match
mm-hmm.
what's on
Right.
paper.
Right. So I think that is a benefit of being a nurse and having that just ingrained in
Yes.
you, that you are taking the whole picture of the patient into account when, and I may be wrong, but from what I know about medicine, it is very scientific based.
It
So.
is. I talked to someone who was teetering on whether they wanted to be a PA or MP.
Mhm.
I said, "Come sit by me." Um, okay, so right now, nurses are guilty about this, and I fuss at nurses who do this.
Mhm.
So I'm gonna sit here and I'm gonna let you answer, but then I'll hold up.
Mhm.
What does your normal week look like right now? We're going to start with you,
Okay.
Professor Miller.
So, and I guess now, not when I was 5 days a week in the office.
Yeah, right now, this week. What does this coming
So,
week look like for you?
tomorrow I will be in the office working in my nurse practitioner role, 8 to 5.
Okay.
And then later this week, I will teach a 201 Intro to Nursing lab,
So is that
a
Wednesday?
skills lab.
Is that
So I will teach
Wednesday?
that Wednesday.
Okay.
And then I have some work for my online RN to BSN course that I'm currently working
So
on
you
that
have
starts
papers to
in
grade and modules to get
so
done.
all of
Okay.
those parts to do. And
Okay.
then I have a peds clinical. We have those on my group is on Fridays. And
Mm-hmm.
so I'm preparing for my next peds clinical.
Mm-hmm.
And
And that entails getting ready, not only being there
right.
before Jesus wakes up,
Yeah.
but you've got 29 pages of stuff you've got to review after. So Saturday.
And then so typically after the peds clinical, I will, get questions from students maybe. So just kind of fielding emails
Mm-hmm.
and then I'll start getting great paperwork from my students
Mm-hmm.
coming in from their clinical paperwork, which is so many pieces to that.
Mm-hmm.
So going through that and then just commenting so that those students can grow in what they're able to do.
So how many hours a day do you think you grade? I grade every day.
Yeah.
I don't feel like I'm ever called. So are you ever on call for your job now, for the
Not
practice job now?
not anymore. No.
Okay, so you have many different roles. What's your week look like right now?
Mine's pretty similar.
You teach, you grade, you clinical,
I'm in clinical.
clinic.
I'm in urgent care, which I have 12-hour shifts. So that's probably the biggest difference.
So you're juggling. Plus, both of you
Have kids.
have younger
Have a
kids.
family.
Young.
Yeah.
They
Young.
Yeah,
go
little. Yeah.
everywhere. How in the world can y'all sit upright?
We just do it. You had
You
said it
just
earlier. You just do
start
it.
doing a little bit more, like
Mhm.
your kids are born,
Yeah.
and you
Yeah.
continue to grow in your capacity. I think over time, and then you
So
just
we're very good about not saying no. We say yes to everything. Why do you think that is with you two?
I think just a desire to be helpful.
Yeah, we care.
Yeah.
That's perfect.
Yeah.
I love that answer. But I also caution, like we tell our students who work in 4 and 5 shifts a week.
Mm-hmm. Got to simmer down. Focus on the
Yes.
priority.
Yes.
Mm-hmm.
But again, with our job, we have that ability to be very
Mhm.
flexible.
Right.
And it sounds like you're where you
Right.
guys work getting your hours in for your MP, they're flexible. Do you ever go in on a minute's notice because they're short at the office, the clinic?
I have told them yes, like these days.
Mm-hmm.
And so yes.
Is it hard to say no?
It is, and like you said, it just depends on the balance of what else going on, but I do lean more towards yes, I have to have a really big
Okay, but you're not salaried anymore though, right?
No.
Okay, good.
Right.
All right, good, good. All right, I'll leave y'all alone. So I love that you guys feel like you have a great work-life balance.
Yeah.
Yes.
Awesome. All right. What kind of personality do you think you need to have as a nurse practitioner?
I think you have to be adaptable.
Yeah, I was gonna say
And like
flexible.
any nurse, you have to continue learning.
Mhm.
Always
So
okay.
myths about nurse practitioners.
Okay.
Ooh, fun.
Rapid fire, don't think, stop looking. Look at me. Eyes here, eyes here. Biggest misconception about an MP.
I get asked all the time if I can do anything a provider can do, and that is a difficult question to ask because yes, they went to school for many, 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 many years to do what they do.
Mm-hmm.
My schooling was broken up in 2 segments along with practice.
Mm-hmm.
But yes, I can write prescriptions, I give orders, I diagnose.
Mm-hmm. Yeah.
Right. I was kind of thinking the same thing, like that you're like their assistant, like that you maybe
Yes.
do the assessment report and then do what they
No.
tell you to do. Like some
Right.
people think it's like a piece of them as more of their assistant, but
It's
that's
not.
not at all what it is.
I don't have a provider with me. I never have a
Most
provider with
ever.
me. Yeah, yeah, ever.
That's okay.
Mhm.
Something people think is easy, but it really is not about your job. Like that'd be a piece of cake.
I think getting charts done.
Yeah, the charting is the most difficult part because you do have, especially if you did have to do your own billing and coding in the past,
Yes.
it's constantly in the back of your brain saying, "Okay." And in my world in urgent care, someone can come in for an upper respiratory infection and it can be very cut and dry, but if they're diabetic and hypertensive
Yes,
and
that's
have
what I was gonna
asthma,
say.
you can throw those diagnoses in there and say, write a sentence or two on those, and it bumps your billing up immensely. So if you take 5 more minutes on that chart, then you can get paid a lot more, but then
But do
your
you
waiting
see the
room is
cost? No, you don't see the cost.
I personally don't see
The
the cost.
provider sees the cost.
Yeah.
Yeah.
Well, like the office. Yeah, the
Okay.
office.
What is something hard that people don't realize it's as hard? And it sounds like you just answered the same question.
Yeah.
Charting?
People think it's hard, but it's not, right?
Yeah.
People think
Oh,
it's
okay.
hard,
Sorry.
but it's
Yeah.
not. Uh,
Oh,
I
I
know
would had it backwards. Think it's hard, but it's not.
I'm gonna say school. The schooling.
Oh, okay. But
No, I mean, for real, I worked full time, I had kids. I don't think it was as difficult as people think it is. I mean, my program did require you have experience and you could pull
Mhm.
from all of that knowledge. It's just a different way of thinking. I mean, you're
Yes.
not learning a new diagnosis. Asthma is asthma.
Right.
Hypertension is hypertension. It's just a different way of looking at it.
Yep.
And is how I viewed it.
I do think that going through the BSN program was
Yes.
more challenge, like a lot of growth had to happen, and there plenty
Yes.
of growth had to happen in graduate school as well. So don't get me wrong there, and you certainly had to put in effort, and you had to have that drive. But you're right, you had a foundation and experience to pull from. So you were just changing your angle.
Mhm.
love that.
Mhm.
All right. So we have a lot of future Pacers listening, right?
Sure.
Yeah. Oh, especially parents too.
Yeah.
Okay. So if anyone's considering it, what qualities do you think would makes a great nurse practitioner? I think I can see him right here with you guys. Interpersonal skills.
I was gonna say patience, like,
Mhm.
not
Yeah,
TS,
yeah,
but
like patience
CES, yeah.
that is a virtue,
Yeah.
which I don't have.
Yeah, you have to have patience.
Yes, you do.
I do not. Have you seen me in Kroger? I know.
Yeah, but you're right, interpersonal skills, that's a good one.
What should nursing students focus on right now if they want to be an NP? It would depend. Really, it kind of just depends on where they are. So, say I'm a freshman coming into school, and I'm declared nursing as my major, but I fully know that I'm going to go straight forward.
Yeah. I think just doing this role well, like doing your
Yeah.
BSN program really well, diving in, and don't think like I'm going to wait until I get to grad school to really like dig in,
Yeah.
but
Like really learn the cranial nerves the first time.
Yeah, that's helpful later. Yeah, it is helpful.
like lay the foundation now and just soak in all the things from clinical.
I agree, like, you have to be passionate about what you're doing in the moment. I, however, will argue I didn't have the best GPA and I still got accepted to grad school. So, and I think part of that was networking. I had great references. I think truly being able to communicate with patients is huge as an NP. So if you can communicate with them, then you're going to get to the root cause of the problem.
So, both of you have a common denominator in your history. Well, you have two, but I'm going to go with the one. You both have ER,
Mhm.
and you both went family practice, even though you're in a pediatrics office.
Mhm.
Do you think that's the most suitable area? Like if you had to tell someone where to go work after their BSN, would you recommend like an ER for family nurse practitioner?
I mean, I don't know any different. I can't really attest. I mean, I can see similarities. I mean, the same people that come into the ER are the same people that you're seeing for the first time in a primary care.
Right.
It might be a higher acuity patient, but upper respiratory is upper respiratory is
It's
upper
heart
respiratory.
failure is
Yeah,
heart
yeah.
failure is heart failure.
When you might not see as much of that in the ICU per se, your patient's vented and
Yeah,
they
we
have
all know.
pneumonia or something,
Yeah.
but it's definitely like the end spectrum.
So
of
obviously,
it.
like pediatric, they need to have worked in peds. And I think as we go into more specialty, like
Yeah.
especially CRNAs,
Yeah.
and then labor and delivery nurse practitioners they're the midwives now. Okay.
Yeah.
All right. Would you choose to do it again if you had to do it all over again?
Absolutely.
Anything
Yes.
different? No? Okay. Y'all are uber excited. All right. So for me, it really just reaffirms my faith that I do not want to be a nurse practitioner. I cannot keep up with anything, much less the 5,000 things y'all have to keep up with. So, but it really has been interesting to hear or learn something new every time I talk to a nurse practitioner. I mean, every
I
time.
love getting to know Amber. I didn't realize. I think I knew that you worked in women's health, but I
Yeah.
didn't know your
I feel
kind of
like we're
path
far
and
more
everything.
similar.
Yeah, we are.
So-
We're very similar.
Adjunct. I mean, not adjunct. She's a full professor, but you know.
Yeah.
So Amber, thank you so much.
you.
We've been trying to get her in here forever, but y'all are coordinating. Did you
We
know
are.
that?
We are.
I did not get the memo.
You didn't. Okay.
So any final words of encouragement from you, Amber?
No, I think just whatever stage you're in, just like dive in and give it 100%, and there will be growth there. Like I told my peds clinical group that I told them, some of you, I'm fully aware that you have no desire to go into peds. You never want to do this beyond this semester, but if you can just like dive in and like really be here when you're here and just soak up as much as you can, there will be evident growth at the end of this clinic.
I have had so many students that just was adamant. I'm not going to be a peds nurse,
And now they're peds.
and now they're
I think some of it's just getting over the like nervousness of being around like a baby or a young child or something like that.
Yes.
Okay, Keegan's.
I completely agree. Just trust the process. And
I keep hearing that phrase.
yeah.
Especially
like that phrase.
after BSN.
Yeah.
So BSN is a different, graduate school I think is a different beast than your BSM.
Yeah.
And trust the process and just find something you're passionate about going to every single day. And then you want to show up every single morning for it.
Yeah. All right.
Cool.
You ready to close us up? It's you, baby.
So, as always, follow us on social media, on all of our outlets. Listen to us weekly here at Pacer Nursing Power Hour. And once again, thanks for
Driving in.